This content is not designed for use as a medical reference to diagnose, treat, or prevent medical illnesses or trauma. If you have questions about the diagnosis, treatment, or prevention of a medical condition or illness, please consult your personal physician.
Hello. Welcome to our second of two lectures on Alzheimer's disease. In today's lecture, we're going to discuss the steps we can take to minimize our risk of getting this disease. Plus, we'll discuss interventions for those who have it, practical tips to help Alzheimer's patients, and some possible directions for future research. Let's start with minimizing risk. One of the best things you can do to make Alzheimer's less likely to occur is engage in regular physical exercise, which helps to maintain good heart health by increasing blood and oxygen flow to the brain. Regular physical exercise has also been shown to increase gray and white matter in certain prefrontal and temporal cortical regions of the brain. If we strive to stay fit and active, we can also control other factors that are associated with the incidence of Alzheimer's disease, such as heart disease, high blood pressure, high cholesterol, type 2 diabetes, and stroke risk. There is no one-size-fits-all exercise plan for minimizing Alzheimer's disease risk, but we do know that engaging in some form of exercise is better than not exercising at all. To help protect from Alzheimer's, the World Health Organization recommends that individuals age 65 and older engage in 150 minutes of moderate aerobic exercise every week, or alternatively, 75 minutes of vigorous aerobic exercise each week. In either case, the exercise should be spread over several days. Moderately intense aerobic exercise includes things like walking briskly, water aerobics, bicycling slower than 10 miles per hour, gardening, and ballroom dancing. Vigorously intense aerobic exercise includes things like swimming laps, bicycling 10 miles per hour or faster, jogging or running, and hiking uphill. It is also recommended that we follow a heart-healthy diet to minimize our risk of developing Alzheimer's, limit our intake of sugar and saturated fats, and eat plenty of fruits, vegetables, and whole grains. I'm not going to tell you that you should follow a fad diet or stop eating certain foods. It's all about moderation, not elimination. Eat healthy most of the time, but also enjoy yourself sometimes. So don't eat a hot fudge sundae every day, but also don't swear off hot fudge sundaes for the rest of your life. Just be smart about it and try to eat with the goal of properly fueling your body and brain. We also know that maintaining strong social connections lowers the risk of Alzheimer's disease. This means forming and maintaining meaningful relationships with family, friends, acquaintances, and the larger community. Picking up a new hobby has preventative benefits too, as this promotes the formation of new connections in the brain. Research also suggests that combining some of these strategies, so say learning a new hobby with friends and family or exercising with them, further reduces your risk of developing Alzheimer's disease. Healthy sleep habits seem to lower our risk too. A 2010 article by Stephanie Bombois and colleagues from the University of Lille-Nord-de-France outlines some recommended habits for sleep and habits to avoid. Recommended habits include developing a sleep ritual for when you go to bed and when you awake, exposing yourself to sufficient bright light and physical activity before sleep, ensuring your bedroom is a restful and comfortable place, only going to bed when you are sleepy, sleeping only in your bedroom, and if you cannot sleep, leaving your bedroom and returning only when you are sleepy. Sleep habits to avoid include frequent daytime napping. So try to limit your naps to less than 30 minutes a day. Spending too much time in bed. Engaging in heavy exercise in the 2 hours before bedtime. Consuming caffeine, nicotine, or alcohol, especially right before bedtime. Working or watching television in bed. And eating a late, heavy dinner. So these are just some of the recommendations for ensuring that our bodies remain in optimal shape, and in doing so, hopefully ward off the development of Alzheimer's. But what about our cognitive capacity? If exercising our bodies has an effect, what about exercising our minds? We know from the scientific literature that new neurons are generated and neuronal connections are formed throughout our lifespans. These things occur when we learn new skills or strengthen skills that we already possess. And we strengthen skills by practicing them. So if we play a computer game that specifically targets the cognitive function of memory, we might expect our memory to improve. By playing this game, we can, in essence, combat the memory problems that arise with normal aging. Marketers know this, which is why you see cognitive training programs, computerized games, and internet-based coursework marketed to older consumers as helping to prevent Alzheimer's. This is similar to the belief that if a person works on crossword puzzles every day, they will keep their brain sharp and decrease their risk of getting Alzheimer's. Are these statements true, though? A 2010 review of the literature by William Reichman and colleagues at the University of Toronto revealed that very well-developed cognitive training programs can help healthy older adults to improve domain-specific cognitive functions. However, and this is important, it remains inconclusive whether this kind of improvement would translate to day-to-day memory functioning. So in other words, a person might show improved performance in the training program or other tasks similar to it, like crossword puzzles, but those improvements might not translate to basic activities of daily living. Very few of the products advertised to consumers as memory aids have been scientifically tested, and fewer still have reported their findings in peer-reviewed journals. If a claim sounds too good to be true, like our product can prevent you from getting Alzheimer's disease, it usually is. You should stay mentally active and engage in things that cognitively challenge you. But there is no need to buy a specific product to do this. Actually, the best thing you could do for yourself is to start a new hobby, because it's very cognitively challenging and requires you to learn things you don't already know. This is also true of homeopathic and herbal remedies like ginkgo biloba extract. Many marketers claim that such products are effective in preventing or delaying the onset of Alzheimer's disease. But research does not support this claim. So to recap, your best bet for minimizing your risk of getting Alzheimer's disease is to do the following things, preferably in combination. Exercise, eat healthy, well, most of the time. Control physical factors like heart disease, high blood pressure, high cholesterol, type 2 diabetes, and stroke risk. Practice good sleep habits. Maintain strong social connections. Learn a new hobby. And engage in activities that mentally challenge you. Let's now turn to interventions for patients with Alzheimer's disease, starting with medication. The U.S. Food and Drug Administration has approved 2 types of medications for the treatment of this disease. And by treatment, I mean that these drugs help mitigate some symptoms related to memory and thinking. Among these medications are cholinesterase inhibitors, which include drugs like Exelon, a brand name of rivastigmine, Razidine, a brand name of galantamine, and Aricept, a brand name of donepezil. These drugs prevent the breakdown of acetylcholine, or ACH, which is a neurotransmitter important for learning and memory. We mentioned in the last lecture that decreases in this neurotransmitter have been noted in Alzheimer's disease patients. These cholinesterase inhibitors appear to delay or slow the progression of symptoms related to memory, thinking, language, and judgment associated with Alzheimer's disease. The drugs are generally well tolerated with minimal side effects. The side effects that have been noted include nausea, vomiting, loss of appetite, and increased frequency of bowel movements. Two drugs in this category, Exelon and Razidine, are primarily used to treat the mild to moderate stages of Alzheimer's disease. Aricept is used to treat all stages of the disease, including the severe stage. In addition to cholinesterase inhibitors, the drug Namenda, brand name of memantine, is used to regulate the neurotransmitter glutamate, which is involved in information processing. Namenda may also improve mental function and the ability to perform everyday activities in some people. Side effects of Namenda include headache, constipation, confusion, and dizziness. A combination of Namenda and Namzaric, a brand name of a combination of memantine and donepezil, is typically used to treat moderate to severe stages of Alzheimer's disease. Researchers have looked into non-pharmacological interventions for Alzheimer's patients too, including research-based cognitive training. Just as some cognitive training programs have been shown to benefit healthy older adults, so too have they been shown to help early disease Alzheimer's patients. But results vary depending on the techniques used. Training that targets a variety of domains, is carefully designed to replicate specific cognitive functions, and is tailored to an individual's ability in each domain, appears to be the most effective. Keep in mind, though, that research suggests that Alzheimer's patients who participate in this cognitive training get better at the tasks they are being trained on, illustrating that neuroplasticity is occurring in their brains. But the training does not necessarily transfer to improvements observed in activities of daily living. So it may not solve some of the everyday issues they are experiencing. Another non-pharmacological intervention is known as repetitive transcranial magnetic stimulation, or rTMS. This non-invasive procedure delivers an electric current to targeted areas of the brain and shows therapeutic potential for a variety of diseases, including Alzheimer's. Research shows that rTMS, along with cognitive training, improves cognitive function in patients more effectively than either rTMS or cognitive training alone. rTMS activates specific brain areas while patients engage in cognitive tasks that target those same areas. For example, it might stimulate the dorsolateral prefrontal cortex while patients perform tasks related to naming and spatial memory, since these functions are related to that area of the brain. In many of these studies, treatment sessions, which typically last 30 to 40 minutes, are administered multiple days a week, usually 5, over a period of 4 to 6 weeks. In many cases, positive effects of the treatment can still be observed 6 to 12 months after treatment subsides. No sedation or anesthesia is required for these treatments, and there is no recovery time after the treatment is administered, so patients can immediately resume their normal daily activities. A number of clinical trials are currently underway to assess the effectiveness of this treatment at the different stages of Alzheimer's disease. So what about exercise? We already know that exercise can help reduce the risk of getting Alzheimer's disease, but can it also help someone who is already diagnosed with the disorder? The answer is Yes, it can. A 2017 research study by Jill Morris and colleagues at the University of Kansas Alzheimer's Disease Center examined the effects of moderately intense aerobic exercise, so about 150 minutes a week, on a variety of symptoms associated with Alzheimer's. In this study, two groups of early-stage Alzheimer's patients were studied. One that participated in a moderate aerobic exercise program, and one that performed non-aerobic stretching and toning exercises. The study then examined how functionally independent the patients were after 26 weeks of participating in the study. As it turns out, patients in the aerobic group showed improvements in their functional abilities after the 26-week period, while those in the non-aerobic group showed declines in these abilities. In addition, those in the aerobic exercise group showed overall improvements in their cardiovascular fitness. And these improvements in cardiovascular fitness were also related to improvements in memory performance and increased hippocampal volume, as measured by MRI. Other studies have found that Alzheimer's patients who have higher cardiorespiratory fitness levels actually show slower disease progression than those who have lower levels. This lends support to the idea that exercise is an important part of health maintenance for patients diagnosed with dementia. Although the best exercise regimen for Alzheimer's patients has yet to be determined, it appears that multi-component exercise training, so the combination of balance exercises, aerobic exercise like walking, and strength training provide important health benefits for patients. Improvements have also been noted in cognitive and motor abilities, as well as in daily living activities. Environmental conditions should be considered too. For example, it has been shown that walking and engaging in conversation with another person provides more benefit than simply walking alone. The socialization aspect supplements the benefit gained from exercise alone. Now let's turn to practical tips we can use to help people who have this disease, starting with tips related to memory. If the patient is in the early stages of Alzheimer's disease, one thing that might help is to provide them with written notes and verbal reminders. For example, if they have a doctor's appointment on a certain day, it could be useful to leave them a written note about the appointment, maybe on a large month-by-month desktop calendar, or even call them a couple of hours before the appointment to remind them about it. You can also use written labels to help a patient identify where things are in the house. For example, you might label a cupboard with the words glasses and plates to remind the person where these items are kept. As the person's disease progresses, though, written words will be difficult for them to read and understand. At this point, labeling cabinets or even dresser drawers with pictures is the way to go. Another practical tip is to leave familiar items, family pictures, say, or a favorite blanket, where the person can easily find them, as this helps soothe them and connect them to their past. It is also important to keep the person's daily routine as constant as possible to avoid confusion. Also, remember that memory loss follows a temporal gradient from newest to oldest. So after a period of time, the person's strongest memories are those associated with a time when they were much younger. Have you ever walked into a dementia unit in a nursing home and noticed the types of TV shows or movies on the television? Or stopped for a moment and listened to the background music playing? Most likely, these mirror sights and sounds that patients watched or listened to when they were young adults. Because they are familiar to the patient, they are comforting. When it comes to problems related to language, it's important to make sure that these aren't caused by a hearing deficit, so a hearing test is definitely recommended. If the person's hearing is okay, but they get lost in the middle of a conversation, You can help reorient them by repeating some of the words they just spoke. And if the person struggles to find the right word for something, you can supply the word if you know what they're trying to say. Be careful though. If you supply the word and it upsets the person, refrain from doing so again. You should also speak slowly and give the person time to respond. They most likely will respond quite slowly. To help with patients' attention and executive function, try to minimize distractions whenever possible. If you find that background television noise or too many people visiting at once interfere with a person's ability to focus on basic tasks like eating or getting dressed, try directly addressing what's causing the problem. For instance, you might simply turn off the TV during the patient's morning routine, or only have one or two people visit at once. Also, when speaking to the patient, ask one simple question at a time. For example, instead of asking, "Do you want to eat an apple or an orange for dessert?" Or, "Would you rather not eat dessert right now?" First ask, "Do you want to eat dessert right now?" Then, after the person responds, follow up by asking if they would prefer an apple or an orange. When the person tries to complete a task, break it into smaller steps. So for example, if they want to make cookies, first have them find a mixing bowl and a spoon and put them on the counter. Then have them measure out one ingredient like flour and put it in the bowl. Breaking up a task like this into smaller segments will boost the person's confidence and enable them to succeed in completing the task. There are a few things you can do to help patients with their visuospatial and sensory and perception abilities as well, like minimizing clutter in the house and using night lights to promote safety. You can also use contrast to make things stand out or to hide things. For example, if you want the person to be able to open the kitchen cabinets, use cabinet handles that highly contrast with the cabinets, like white handles against a dark wood. And if you don't want the person to open the cabinets, use something like white handles against white cabinets so that the person won't see them. To help patients know where the toilet is, I highly recommend either using colored toilet water so that it provides them with a target, or alternatively, putting a dark colored toilet mat around the base of the white toilet so that they can easily identify it. One strategy that has worked for some people who have trouble with the patient leaving the house undetected is to place a black floor mat in front of any doors in the house. Many patients will see this black floor mat as a hole and won't step on it. Finally, we come to mood and orientation. Because many patients suffer from depression and can become fairly withdrawn, encourage them to socially interact with visitors. Have only one or two people stop by at any given time so the patient doesn't become confused or agitated. Another tip is to have the person do activities they can successfully complete to boost confidence, which turns out to be critical to long-term vitality. Different activities can be used as the disease progresses. Many patients receive great satisfaction from something as simple as folding towels. It's easy for them to do, and it generally makes them feel good. Finally, as we talked about before, use a large desktop calendar. If the person is no longer in the early stages of the disease, writing appointments on the calendar will not benefit them. But crossing out each day as it occurs can help orient them to what month and day it is. Before we wrap up for the day, a few words on future research directions related to Alzheimer's. We discussed earlier that most treatments for Alzheimer's disease are geared toward temporarily helping patients with memory and thinking problems. Well, some of the current clinical trials for treatment actually focus on slowing the progression of the disease or possibly treating its underlying causes. Some of the drugs currently in development target beta amyloid to try and keep plaques from forming in the brain. Others target the protein tau to help prevent neurofibrillary tangles from developing. And still others target inflammation in the brain, which plays a role in some of the changes that occur with Alzheimer's disease. Another future research direction involves the use of stem cell therapy to treat patients with Alzheimer's. Although there are different types of stem cells, they all have three basic properties in common. One, they are capable of dividing and renewing themselves for long periods of time. Two, they are unspecialized. And three, they can give rise to specialized cell types. The basic idea is that one could use these cells to aid in the regeneration of damaged brain tissue. Although stem cell-based replacement strategies have shown promising results in animal models, there are still many hurdles to overcome before they can be used in Alzheimer's disease patients. Why? Well, in Alzheimer's disease, there are many different types of neurons that are destroyed in many different parts of the brain. Trying to replace these many different types of damaged neurons and control how they interact with one another proves to be very difficult. As I mentioned in the previous lecture, Alzheimer's disease was first discovered in 1901. That's a long time ago, and we still do not have any breakthrough treatments that will stop or prevent this disease from developing in the first place. Needless to say, it's complicated. This disease affects the entire brain, so its effects are global. I'm hopeful, though, that with continued advances, someday we'll be able to eradicate this disease. I hope that these two lectures on Alzheimer's disease were informative for you. In our next lecture, we're going to take a look at two other dementia-related disorders, Lewy body disease and vascular dementia. I'll see you then.